Good evening, everyone. Thank you, Dr. Arvind, and thank you, MPO, for this opportunity. Today's talk is really, as a disclosure upfront, is sponsored by MPO, but it's really going to be as much scientific as possible and to talk about, of course, they brought about Cidofovir as a generic drug, and that's something that's useful for us. We'll also use this opportunity to discuss with the experts in the field, and I'm very grateful to Dr. Francisco Marty for coming on at a very short notice. I'll introduce him in detail when his talk comes up. The overview of this session will be basically Dr. Biju was supposed to be here. Unfortunately, he had kind of an emergency at home and had to travel, and so he could not make it today. So I'm going to try and do his slides, and I'm never going to do as good a job as he is. He really handles all the infection problems in our transplant program, and it would have been great if he was here. It's unfortunate that he couldn't be here today, and I'll try to go through his slides and give you a sense of our own data. And this will be followed by a talk by Dr. Francisco Marty, who's the Associate Professor of Medicine at Harvard Medical School, Dana-Farber Cancer Institute at Boston. He's a familiar figure in India, and he's very actively involved in all the Indus PMT educational programs, and we're always grateful to him. He always gives us very practical insights on how to handle many of these very complex infection problems in the post-transplant setting. We also have with us a set of panelists. We will have the two talks in series without any interruption. And we have with us Dr. Dharma Chaudhary, and most of them are very familiar to this audience. Dr. Dharma Chaudhary is at BL Kapoor. Dr. Sharad is the clinical director at Narayan Hridayalaya in Bangalore. Dr. Ganesh Jateshwar is the consultant hematologist at Yashoda Hospital in Hyderabad. Dr. Kashi Vishwanathan is the director of transplant at Meenakshi Mission. Dr. Neeraj is from Amrita. And Dr. Mamta Manglani is the director of comprehensive thalassemia care at Mumbai. Thank you all for coming on again at fairly short notice. And with that, I'm going to start. The flow will be that after the two talks, we will open it out for questions, and the panelists and Professor Francisco Marty will kind of weigh in on the discussions and give them both a local feel and also an international perspective on state of the art in the management of viral infections, especially in the context of CMV.